What actually made you interested in hair and sexual wellness?
I had a lot of patients, women in particular, that would come to me with hormonal chaos, emotional dysregulation, and just feeling overall crappy with their health. They would come to me from their doctors, and their doctors would be like, well, this is just the normal process of aging. You just need to sleep more, you need to drink more water, and you need to eat better. But they would never really get the proper protocols. And then when I became familiar with stem cells and peptides, I've seen such amazing results with patients with their libido, with their overall confidence and feeling good from the inside out. I saw firsthand what stem cells and peptides can do, not only just somebody's internal health, but just the way they feel even externally. And I think that's a big missing component when it comes to medicine.
This is Dr. Joy Kong, and today I'm excited to be interviewing Dr. Shivani Amin. Dr. Amin is a pioneer at the intersection of science and the spirit. And she is an expert in the area of hair restoration, sexual wellness, and just overall regeneration of the body. And we're diving deep into her approach at hair restoration and also sexual function improvement, and talking about how peptides and stem cells and exosomes can jumpstart your health and get you to a place that you want in how you feel and how you look. Dr. Shivani.
Hello.
Welcome to the show. I'm so excited.
I'm excited you have me on.
Yes.
How fun.
We've known each other for a while, and I've really enjoyed getting to know you and know your expertise. And now you're actually part of the clinic and providing your expertise to our patients. So I want to introduce you to my audience a little bit. So you're actually interested in a lot of things, but some special areas that really speak to you will be the area of hair restoration, right, and sexual wellness, and also spirituality. So that's all these things are something that you spend quite a bit of time on. So what have you seen as far as stem cells and hair? Like, how do you approach hair?
That's a great question. So everyone's different. What I appreciate about what we do here is it's a very personalized approach. There's a lot of clinics out there that will just have the same protocol when it comes to injecting exosomes and stem cells for hair rejuvenation or even facial aesthetics. And I don't believe in that because, again, we're all built differently, right? Our internal terrain is so different. And so you analyze a patient. For me, it's a very unique approach because I do mind, body, and soul, where it's kind of like science meets spirituality. And I work with the patient, I work with their lifestyle, and I analyze. So if I'm doing hair restoration, I analyze the area that they would need it, and then you calculate based upon that. It's not just everybody gets a certain amount of stem cells, and that's what's going to produce results, which is what a lot of clinics are doing, and that approach doesn't work because
it doesn't sound very scientific.
No.
Yeah, unfortunately, I see that a lot. It feels like it's like an exosome mill or stem cell mill that people, you come here, this is the price, and this is what you get. But for God's sake, everyone is different, and and you approach hair also based on what the origins of the hair loss may be, right? Like,
correct.
How do you analyze when a patient come to you?
So you look at the particular area where, there is decreased blood flow, the hair follicles aren't, they need the regeneration the most. And so for different people, it's different areas. It could be the front of the scalp, it could be the back of the scalp, it could be the side of the scalp. So you have to analyze all of that. Again, a lot of the clinics here in particular, even in California, I know that it's kind of like you said, it's like an exosome stem cell mill where they're just giving the same amount of stem cells to everybody. And that doesn't work because we're all built differently.
Yeah. Do you, so for male and female hair loss, do you approach them differently?
Again, yes. So females also, so a lot of times by the age of 30, 35, now they're saying it's been statistically proven that and by research that they're losing about 30% of their hair and more after giving birth because of hormonal dysregulation, the internal toxin terrain. So I analyze all of that in our protocols here. That's the reason why we have a very thorough protocol. You have to get to the root cause of what's causing the issue from the get-go. It's not just a symptomatic, again, relief. Like, you don't put just 5 cc's of exosomes in someone's scalp and be like, oh, you're going to see regeneration. Everyone's different because there's an underlying root cause to every person's issue, right? So for somebody, it could be autoimmunity. So you could do the stem cell injections, but if you're not treating the underlying cause and you're not getting to the root of why they had that issue in the first place, you're not going to see as great of results. And that's why I love the protocol that we do here at Chara Health, because it's addressing mind, body, and soul. And like, it's a holistic approach, which works the best.
So how do you decide if somebody has autoimmune condition as part of the issue? Because a lot of the autoimmune issues are not diagnosed.
Correct.
So how do you go about?
We do it through lab work. We do we do micronutrient tests. We do like a thorough history and physical, a thorough assessment in their first consultation with us. And that helps us to address what's going on underneath. And a lot of these clinics here, they don't do that. You just go in and they promise you these ridiculous claims like you're going to see 40% of hair growth with just this one session of exosomes. And you can't say that, again, because we're all different. Like if I started losing hair and I came to you, my issue would be different from what your issue was, right? And you're never going to know that if you're not doing the right amount of investigation, I would say. And that is through blood work. That is through different lab testing and all of that, which is what I pride ourselves on here, because we have that protocol.
How receptive are patients when you want to do labs? And because a lot of people, to be honest, they want quick fixes. They want something fast and simple. Just give me this. So how receptive are they if you want to run more labs? And
some aren't. That's a great question. But when I explain it to them, they are open to it, right? Because it's never been explained to them through that means. It's always just like these, again, I want to say false promises that you're going to see 30 to 40% of hair growth just by injecting stem cells once. Well, that could have been the case for one person because maybe their internal terrain was, not toxic. They don't have as much stress, but you have to analyze all of that. And a lot of times, even with just like nervous system regulation, even just with getting back into the normal cycle of life by being in tune with nature can change your internal terrain. So you don't necessarily always have to order all these tests, but I like to do that because I like to, again, like you said earlier, a lot of times autoimmunity hasn't been picked up by their primary care physician.
Yeah. So when you do come to the point where you're using stem cells or exosomes for hair growth, like how does that work? Why does it help with hair?
Great question. A lot of clinics here in the United States are using exosomes for stem cell regeneration, and exosomes are great. I love exosomes. They have a high affinity for inflammation. So in the scalp, they go to the hair follicle and they're kind of like messengers that say, hey, we have a lot of inflammation here. Let's decrease it. They're extremely intelligent. They have a higher affinity, I would say, and work a little quicker than stem cells. But you need the stem cells because they come from stem cells, right? And so stem cells produce a better result in terms of hair restoration than exosomes from what I've seen.
In what sense do you think is better?
In terms, what?
So does that promote more hair growth?
I've seen better results, yes.
Does the result last longer?
It lasts longer, produces better hair regrowth. And so that's why we have the protocol we have here. And I tend to use the stem cells over the exosomes.
Yeah. Well, in the field of regenerative medicine, some people say, well, now we have exosomes. We don't need stem cells. What are your thoughts on that? Because, it's a popular thought. It's
correct. And that's the reason why all these clinics are using exosomes, right? And again, they're great. They cross the blood-brain barrier. So they have high affinity for inflammation, like I had said earlier. So they're great to use, but again, they come from stem cells. So you do need, it's like what I talk about, that holistic approach. Why would you just use the exosomes when you can use stem cells? And they do, and they have produced better results.
Right. I think exosomes probably just easy to use, right? They will go right through the skin. So that's, you don't have to puncture the skin. It makes it very simple. But the stem cells, they're so large, they can't cross the skin barrier. So you have to inject. But once you put it in there, they live there and they can travel, you know, throughout. They can cross the plane. Well, some can even get into your bloodstream. But once they're there, they will continue to produce the exosomes. So they're kind of like exosome factory that they will keep giving you exosomes. Not to mention, I think they're going to give you more specific exosomes. If they are in the scalp and near your hair follicles, they're going to produce signals that's more relevant to that area, instead of if they were, let's say, ended up in your muscles. They probably will work, send signals that's more relevant to the muscles. Yeah.
I agree.
So what kind of results have you seen with hair restoration? How do, like, at what point do people give up on the idea of hair restoration instead of going to hair transplant?
That's a great question. I've actually seen patients who have done hair transplants and then they come in for stem cells and exosomes because their hair, they go overseas, we don't know what products they're using, and their hair starts falling out. So they want to come and they want to try the new and hottest treatment, which is stem cells and exosomes, right? And I always say you want to optimize your health. And I would say that it's best to start off with doing stem cells because that sets the terrain, that sets the hair follicles up to, if you eventually do need the hair transplant in a couple of years, then you can do that. But this procedure, I mean, we're like at the precipice for the first time with these intelligent cells. Like, why wouldn't you utilize that first and allow your body to thrive and heal versus going straight to a hair transplant, right? And so I've seen amazing results. I've seen incredible results just by doing just one treatment of stem cells. Again, everyone's different though. So you really do have to get to that underlying root cause of what's causing the issue, whether it's male or female. And a lot of times that is the stress. And a lot of times that is the hormonal like rebalancing that you do first, the gut balancing. And then when you do that in conjunction with the stem cells, you see amazing results.
The stem cells, as far as promoting that kind of results, one is it reduces inflammation in the area, right? And how else does it promote regeneration of the hair?
So it reduces the inflammation at the follicle. It does angiogenesis, so blood vessel formation and blood flow, which is you need oxygen, obviously, to the area to cause the hair to regrow. And then tissue repair and, nerve damage if you have it in your body as well. So for me, I like optimizing the entire body because I'm a huge believer in mind, body, and soul. You can't just treat one area and expect to heal it's like symptomatic relief. And so I always combine IV stem cells with doing hair restoration. And that's where I've seen the best results. And that's where I feel like our clinic stands apart from other places because, again, most of these places are just come in, do this one treatment and see great results.
Right. You want hair relief, we'll give you hair relief. But there's nothing else that they were addressing. Yeah. So, how I conceptualize is that when you are giving the body an IV infusion of stem cells, it not only goes everywhere, right? It can get to hair. I've seen people with hair regrowth after just IV stem cells because there were a lot of underlying immunity issues. And once you fix that, all of a sudden there's less attack on your own body at the hair follicle level, and there's less inflammation. All of a sudden the whole regenerative signals can happen. But they can also talk to your immune system. The cells through the venous route, right, through your blood, they go everywhere, including your spleen and all your peripheral lymphoid system. And now you're waking up the whole body in this underlying machinery that really helps you fight anything that you don't want, right, in the environment, but also rejuvenate and stay young. So our immune health, of course, is really important for our youthfulness. Yeah. What about sexual wellness? So can you explain what your approach is? Well, of course, men and women are different. Let's say a man has concerns about sexual function. What's your approach?
So again, a lot of times in men, it's when it comes to like ED, erectile dysfunction, there's low testosterone there. There's usually like decreased nitric oxide production, and so decreased blood flow to the area, and also increased cortisol production. So we address those through different lab assessments. Sometimes I like doing a mineral micronutrient test to see if there's any underlying mineral deficiencies that are causing inflammation. So we do all of that, and then the stem cells are injected into the area. It doesn't hurt. It's probably one of the procedures. I hear that, men say that they didn't feel anything at all because the numbing cream, for some odd reason in that area, you just can't feel anything. Maybe a little bit of pressure during the procedure, but they have increased blood flow, and then it increases their sexual performance and their stamina, and then they feel great, right? And so the stem cells are not only healing you at the physical level, but they're also increasing that confidence and vitality so that now you're feeling good from the inside out, right? And who doesn't want that?
Yeah. Oh, so I forgot to mention. So as far as hair restoration, because I'm thinking about, how many sessions people will need for hair. How many sessions do you think people usually need?
Generally, it's about 3. But, again, if you optimize their health with other things, such as rebalancing their gut, nervous system regulation, then some people, I've seen great results. And if they do it in conjunction with the stem cell IV, sometimes it could be 2 sessions. Sometimes it could be 1. Again, everyone's different, but the average is 3.
And how far apart do you spread them?
Usually about 3 months apart.
Oh, that's a long interval. Yeah. What's the reason that the interval is so long?
The exosomes and the stem cells, they usually peak around 3 to 6 months. So like I said, some people might need 2 sessions of it. Some people might see great results with 1. That's the average.
So you want to give it enough time to see how far you were able to get this person.
Correct.
Okay. All right. And then the same question is also there for sexual wellness, like for a man with erectile dysfunction. So a lot of them just simply cannot have a good erection for sexual activity. How many sessions do you think they would need?
Again, so it's you address the underlying issue, and then, after the procedure, you also send them home with like a penis pump or an ultrasound, so that the whole goal is to get more blood flow to the area. So the stem cells are already doing what, they're peaking and doing their work internally, but you want to continue to help your body do the work afterwards as well. And so we combine that with peptides as well, which I know we're going to get into peptides in a little bit, but same thing here, 2-3 sessions. It's the same thing as the scalp, you just want to give the exosomes and the stem cells time to do their work and peak, and then kind of see and analyze and follow up with the patient to see how they're doing.
Yeah. Do you also wait for about 3 months? Okay. Yeah. And one cool thing about stem cells, I think a lot of people don't realize, is the antifibrotic properties. So it actually can break down scar tissue. And one of the very distressing conditions is Peyronie's, the abnormal curvature of the penis because of inflammatory plaque formation. And I don't know if you've treated Peyronie's.
I have not here.
Okay.
But you bring up a great point. But that's why we wait as much as we do, and we follow up with the patient.
Yeah, I've seen Peyronie's recover with one simple treatment. It's pretty incredible and there's really good research backing it. So the antifibrotic property, I'm sure that will help with the erectile dysfunction too, because they're also scarring in the penile tissue, right? From, I guess, is just from the aging process, from the lack of cardiovascular health. Do you see erectile dysfunction always kind of coupled with cardiovascular, I guess, imperfections?
Yes, you bring up a great point, and that's why there's a particular peptide that I also recommend that works really great for cardiovascular issues, because you have to think about it. It's like that decreased blood flow, right? And so that's what the stem cells are doing with the fibrotic component to it. And so a lot of these patients, they have many underlying issues, not just the decreased blood flow. It's a detoxification issue. It's high stress. It's high inflammation. So it's all kind of working in conjunction with each other.
Yeah. And what peptide are you talking about?
One that's Dr. Kong's favorite too, and I do love it. It's epitelon. And what it does is it helps with the vascular integrity of the blood flow and it also helps with hair regeneration as well, because it increases the lifespan of the hair follicle. But epitelon increases your telomeres, right? So it's great for longevity and cardiovascular health. And so there was a research study that showed that it helped your heart age backwards by 9 years. So it's one of the greatest peptides that I don't think a lot of people utilize often. And it's amazing. They should.
Yeah. I think of it as one of the best health insurance policies that you can get, because literally, so in that study you were referring to, people got 6 rounds of epitelon in 3 years. And each round is only 15 days. So it doesn't seem like very much, right? You take this little tiny subcutaneous injection for 15 days, and you only do that twice a year. So 3 years later, well, they only did it for 3 years total. And then they followed them for 10 years. And then they realized the people that got it, their cardiovascular system was 9 years younger. And also the death rate from cardiovascular disease, because all those people in the study had cardiovascular disease. So, and they were age 60 to 69. And then at the end of the study, 10 years later, the death rate from people that do not get the epitelon was 83%. But the death rate from the cardiovascular disease from people that actually got the epitelon was only 46%.
That's amazing.
So you just cut down, you improved you doubled your chance of survival, right?
Right.
Wow. So that one that you recommend. Any other peptides you recommend for sexual wellness?
I love the world of peptides, because peptides in conjunction with stem cells, it's like precision medicine, right? It tells your cells, it's not forcing your body to do anything, but it gives your body the tools it needs to really increase the energy and the rejuvenation in certain areas. And so for hair restoration, I love copper peptide, which is GHK-Cu. It stimulates collagen production. It stimulates dormant hair follicles and angiogenesis. So I tend to incorporate it topically. People tend to inject it subcutaneously for that increased, stimulation when you do facial aesthetics. It's probably the hottest peptide, I would say, when it comes to hair restoration right now. And then I use thymosin beta-4, which is not as commonly used, but I've seen great results with people that have sensitive scalps. It tends to decrease the inflammation in the area and really optimize the way that after stem cells, the way that the hair follicles regrow. So that's another one. If somebody's hair is really dry or sensitive, I use that one.
So you're talking about sub-Q injections after the treatment?
Correct.
Okay.
Yes. I've seen great results with that one. So, and then the epitelon, which we talked about. And then for sexual health, there's so many. So
just hold on a second before we get to the sexual health. So the GHK copper, are you mostly using it topically, or do you use it for sub-Q as well?
I use it in conjunction. So you could do it after I do my procedure, I do it topically. And then I also recommend it to the patients to do sub-Q, because it helps not only with the hair restoration, but also facial, right? Because it has that collagen production component to it, which is why it's one of the hottest peptides right now.
Right. It's incredible for wound healing, but it's even great for brain health. Yeah.
I've actually used it when I had acne too. When I was going through some stress, you just put it right on top and it works. It's incredible.
Oh, wow.
Yeah.
Wow. That's amazing. Okay. Yeah. So, and at our clinic, when we do the stem cell or hair restoration, we actually use a solution that has copper peptide.
Copper peptide, biotin, hyaluronic acid. So that's why we use it after we do the hair restoration. That's why the patients see such great results.
Yeah. So I think you put it on top of the scalp and do microneedling, right? And then you also have them go home and continue to use it. Okay. Amazing. Yeah. So that will be a GHK copper, epitalon, and thymosin beta 4. Yeah, which is great for cardiovascular health. And that's, and you're saying reducing inflammation is great for calming inflammation.
And people that have like sensitive scalps. So I've seen, for some reason, thymosin beta 4 does really well.
Okay, amazing. And then what about the sexual wellness? Like, how do you utilize peptides?
There's, like I said, there's so many. One great one is PT141. And that one I really like because women who have hormonal issues, who love their partner but are just not feeling it, this one works really great because it works at the brain and the nervous system. So it doesn't work at the blood cell level, it works at the brain. So it increases that libido and arousal. So it's great for men and women both. I utilize that one a lot. There's Kisspeptin 10, which helps to release testosterone, LH, and FSH, the hormones in women. So it helps to regulate their cycles. If they're having issues such as PCOS or endometriosis, that one works really well. It helps with infertility. So
Kisspeptin, really? Okay.
That one's really great. And then there's thymosin alpha one. It works really well because of the immune component. So a lot of times when women are having sexual dysfunction, low libido, it's because of hormonal dysregulation, right? And that whenever there's hormonal issues, there's usually for a lot of women, an autoimmune component tied to it. So some sort of immune reaction that's going on underneath underneath the surface. And so thymosin alpha 1 works really great. And then there's BPC 157, which is another really hot one that works really great for muscular stuff, but also it works at the gut level. And so again, whenever there's hormonal dysregulation, inflammation, like sexual issues, there tends to be a gut, like an issue at the gut level. And so that one works really well as well. And then you can also use oxytocin, that helps to increase the arousal in women. There's so many different ones. Again, I work with the patient at an individual basis to kind of see what they need for their particular issue and kind of go from there.
Yeah. Yeah. So PT141, I have a funny story. I gave it to a patient and she was using it with her partner. And it was funny. I think she said they both took this little subcutaneous injection about 2 hours before they thought they were going to, be in bed and have their activities. And then nothing happened. So they both went to bed. But I think the man snored. So they were sleeping in separate bedrooms. So at about 2 a.m., she woke up feeling aroused. And she was thinking, gosh, it would be nice, right? But she didn't want to bother the husband because it's the middle of the night. And the sad part was the husband was feeling the same way, also waking up around the same time, also did not want to bother the wife. The next morning when they reconvened, that's when they found out. So it's just interesting because it happens at different timelines for different people. Because, the instruction says you do the injection half an hour before sexual activity. But really, it does. You don't know when it's going to hit you, right?
Right. Again, to your point, it's because everybody's body is different, right? So that's just like the average general thing they tell everybody. And so to your point, it's different for everyone.
It's pretty amazing, to have a peptide that can help you pinpoint, where you want things to happen. Yeah, it's definitely very powerful to add that to the clinical practice. Like I've been using stem cells for years. I mean, it's been 10 years since I got into the field. And when I encountered peptides, I think that probably about 5 years ago when I started incorporating it into the practice. It gave me so much more sense of, I guess, effectiveness or, power as a doctor. It's like, yeah, I know what to give you. I've got just the right thing for you.
It works great in conjunction with stem cells. I think it's the future of medicine, stem cells and peptides.
Yeah. I liked you kind of mentioned that it helps with energy of certain fields. That's something I don't think I've heard people put it that way. People are always talking about receptors and this and that, but there's an energetic component to this as well. There are 300,000 different kinds of peptides in our body. I mean, we're literally just a universe of peptides. Think of them as stars. They're just all over everywhere. They're all swimming, together. They're present, of course, in different tissues and different amounts, but it's an incredible, miraculous, the human body containing these elements. So when we give certain peptides that we know are good for particular organs, they may somehow energetically help with that organ. I think that's something that our science has been so stuck in the biochemistry stage. It hasn't gone enough to the physical arena, the physical aspect. I mean, that's what chiropractors do. They deal with a lot of the physical, the alignment, which has a lot to do with the energetics of the body.
The subtle body.
Right. And same thing with the fact that we've incorporated laser therapy or shockwave therapy, right? Ultrasound therapy. All these are using energy as a form of signaling. Yeah. So how do you see energy medicine as being part of the new way of doing medicine?
I love this question because, again, stem cells and peptides and energy medicine is where I feel medicine is moving and where I feel Chara Health really sets apart from other places because you've developed such an amazing protocol that includes that missing component. Everybody's always treating at the physical level. And then mental health became such a big thing, and rightfully so, because the mind and the body talk to themselves, but you're a human being, but there's an energetic component to you. You have a subtle body that radiates almost 6 feet out in every direction. And so that energetic component is what's been missing in medicine for such a long time. And that's why I always talk about science meeting spirituality, which is what we're doing here, meeting the soul, meeting that energetic subtle body. And that is through light medicine. That is through directing these stem cells through certain frequencies of light therapy that really, your body's intelligent. It wants to thrive. It wants to heal. And given the right environment, the right tools, it can. And that's what we're doing here. And I feel like congratulations to you. I mean, you're such an inspiration to so many because, I mean, that's why we're seeing such great results here, because other clinics are not incorporating that. And you need to, you can't just treat a symptom. You have to really treat a person as a whole.
Right. This is why it's complex, right? I refuse to compromise because when people want to come to our clinic, we actually have a consultation, right? They do a consultation with a doctor and we spend a lot of time with them understanding each person's needs. And I know plenty of clinics, they skip that step because they have somebody that's more in the sales capacity to talk to the patient, telling the patient, oh yeah, this is what you're going to need. This is how much it's going to cost. Yeah, it's going to be great. It's going to help you with all these things. But there's no substance, that you're not hearing what this person actually need. You're not truly help. Yes, you can throw them some stem cells and it can promote repair and, promote some benefit. But to me, that is not the kind of standard that I want to, have for my patients. That we need to be doctors, right? And clinic, you need to be, to allow doctors to be doctors instead of the doctor just, okay, so everything's set up. We know how much product you need and we just give it to you in the IV or do an injection. You're like the button pusher. There's not enough thought behind it. So how important do you think lifestyle the difference makes for a patient's outcome.
A huge difference. The body's like a soil. I mean, if you're putting in stem cells or any sort of medication into a body that's inflamed or toxic or highly physically stressed, then you're not going to see, you're not really going to be able to see the body thrive. And so, to your point, we do treat the body with a holistic approach and addressing internal detoxification pathways. What's their oral health like? That's another thing that's always like missing and the reason why we do such a thorough consultation and really hone in on our patients individually. A lot of times you'll find that they have cavities and root canals and wisdom teeth pulled with like metals put in there, like all sorts of junk. And you need to address that because, again, a lot of clinics where you just get these stem cells and exosomes and you're in and out of the office, they don't address these things and then they don't see results. Well, why? Because the detoxification pathway wasn't addressed, the stress levels weren't addressed, the energetic body wasn't addressed, and you're just throwing things at it, hoping to, again, you're basically replacing medicine at this point with stem cells. And essentially, it's the same thing. It's systematic. And that's the reason why we're so different. So, that's a huge, huge component and it needs to be addressed.
Yeah. Yeah. It takes a little more work, but that's what's going to, keep everything thriving, at a level that a person wants to be. I'm very much about, I like the word anti-aging. I know a lot of people don't like the word anti-aging. I think it's a beautiful word. You're really anti-declining. You're the anti-decline, you can call it anti-decline medicine, but it's really about how there are all these things we can do to reverse the trend of decline. There's so much that a patient can do for themselves. I really want, I see this, and I was just talking with somebody about this, that Western medicine, the way we were trained, both you and I were MDs, and the way we were trained is that, one, you don't treat yourself. Two, you don't treat your family. And when I heard that at UCLA, I was like, what? I know myself very well, and I know my family. My mom knows me way more than any pediatrician that she had brought me to, trying to explain everything, right? Trying to give all the information. But to say that because I'm a doctor, so I've lost all my objectivity when it comes to me and my family, I think that is just as ludicrous. But that's what we're taught. And we thought, you never treat yourself, never treat your family. And that's got to change. You got to take responsibility and you take care of yourself. There's so many things you can do and learn as much as you can.
I agree.
But also get expert help. Sometimes, you can only push this far, right? So what do you say to somebody who seems to have tried everything with doctors or on their own? Like, what do you say to them?
That's a great question. That, you're not failing at your health. You can be the CEO of your health. And it's just, you need the right tools. You need the right support system. You need the right environment. And that's what we thrive with here at Chara Health. We are addressing the patient with the right tools, the right environment, the right support, with all these different modalities. And we really do get to the root cause of what's going on and help you as an individual versus just throwing common same protocols everywhere for everyone. And that is, where I think medicine is going. And so there's always hope and there's always help, but you have to be able to take responsibility for your health. The doctor, we're here to help you, but also it's your responsibility to seek out that help.
Yeah. And it's our responsibility to continue to expand our horizon because we're still learning as well, just like the patients. But, maybe we have a head start because we went through years of medical school. But the world of medicine is expanding at a rapid rate. So even us need to constantly keep up and learn about new therapies and new things. It's very exciting. And that's the thing that I would love to see more, is that more doctors are more open-minded. That because I don't know what the percentage is, but maybe 80% of doctors are still not well-versed on stem cells and they still don't know enough to the point where they're discouraging their patients to receive the treatment. And that is really sad because they're in the position to help, but they ended up robbing the patient of an incredible opportunity to heal and improve their quality of life. So I've seen that over and over again, but I think it's our responsibility to always be the better doctor.
And you're doing that, Dr.
Thank you.
You've started it. So.
Thank you, Dr. Shivani. Well, this is fantastic. It's been wonderful chatting with you, and thank you for your passion in helping patients in a way that really addresses the root causes.
Thank you. Thank you for having me. How exciting.